history. Now we want to look at his tummy. We've got a set of obs. Can I just get you to put your arms down by your sides? Okay. Are you comfy as you are?
Yep.
Yep. You warm enough?
Yep.
Yep. Okay. So first is exposing the tummy. So bringing up the top so it's just above the ribs, and this down to the groin line. Okay. So we can see what's going on. First we inspect his abdomen. So you're looking to see if it's obviously distended, if it's moving with his breathing, if there's any obvious scars there. He's got no scars. His tummy doesn't look distended to me. Does your tummy seem big to you or about normal?
Normal.
Normal, good, okay. Do you mind if we undo your... So, and there's no scars. He tells me he's had a, was it the right side?
Right side.
A right inguinal hernia before, so there might be a scar there. Can you point to where the pain is mostly?
Right there.
Right over there. Okay, right. So we start away from the side of the pain. So we've looked first. Next thing is, if we're wondering about bowel sounds, we should listen to his stomach. Has anyone got a stethoscope? I'll get it. Okay. But he's opened his bowels yesterday and he's done a pee today. He passed any wind today?
Yes.
Yes. So it sounds like he should have normal bowel sounds. Can I start by having a listening to his bowel sounds? He's got active bowel sounds. One of the tricks for someone who maybe has a tender tummy and is unwilling to let you touch it is you can examine it using a stethoscope. So the way you do that is, so actually palpating but using a stethoscope. So you might listen and then you might feel a bit deeper with your fingers sort of on either side of the stethoscope. So you're actually feeling with your fingers, but the patient doesn't necessarily know you are examining their abdomen. Okay, so his bowel sounds are normal. So we start normally away from the side of the pain, and with the flat of your hand, we just start with a gentle palpation. So I'm just going to touch your tummy gently. Tell me if it's sore at all. So checking the right lower quadrant, middle and upper quadrants, just gently. Not sore when I do that?
No,
good.
Not sore.
And then left, sore down there?
No.
No. Sore in there?
No.
For a gentle touch? Sore up there for the gentle touch?
No.
No. And then when he was actually sore was more laterally, so just gently sore over there when I touch that?
Not there.
Not really?
There.
Sore even with the gentle touch, just touching it there? Right. Sore up there?
Not quite.
Okay. And further at the back?
No.
No. No.
No.
Okay. So even gentle touch, it's quite tender there. Having said that, can you give me a cough? So I'm feeling to see if there's a hernia in the muscle wall there, because a gentle touch is uncommon, that would be sore out laterally, and this is where the muscles come out to the side, and sometimes you can get a bit of an issue with the muscle in there. I can't feel an obvious cough impulse. So now we go a little bit further, so I'm going to feel a little bit harder, okay? And we press down with the flat of our hand, see if you can feel any lumps or masses, feel that it's nice and soft, and then let go quickly for rebound tenderness. And if there's peritonism, you'll get the people saying, ow, that really hurts there. And now we check here. Gently. Is it sore at all when I'm doing
Nothing.
this? No, good. In the right upper quadrant, you've got the liver. So we tend to start lower, and then with the flat of your hand, you're scooping it up towards the liver. So push in. Take a big breath for me, and out. And we press in to see if we can feel the liver edge. And another breath in and out. Not tender when I do that? No. Okay. So that's checking the right upper quadrant. If he had biliary colic or cholecystitis, he might be tender when we do that. Now we're going from the left lower quadrant. So when I do that?
No.
No. And while I'm down here, I might just check for a hernial tenderness. Give me a cough. Okay, not sore when you do that?
A little bit.
Down here?
From the sore spot.
Oh, it's sore at the sore spot when you do that? Okay, but not sore down where my hand was? No. Okay. So press in deeply. Okay. Not sore when I do that?
A little bit.
Sore where my hand is or up where the sore spot is?
There, 2 fingers.
Where my fingers are?
Yeah.
Okay. Sore when I'm pressing down there?
No.
No. So when I press up here?
No.
No, good. Now the spleen's over here. If we're wondering about splenomegaly, you normally start from the umbilicus And again, pressing with the flat of your hand and up towards the spleen, scooping up with your fingers to see if you can feel the spleen. The spleen's quite deep. I'd be unlikely to feel it in this gentleman unless there was something very significant going on. Given he's got an acute presentation, that would be unlikely. Now, finally, right over the spot where it's sore, I'm just going to feel at the top of the hips. So this is checking for both musculoskeletal and abdominal tenderness. So at the top of the hip, not sore up there.
No.
Just over the top of the anterior superior iliac spine, the hip there. Sore by
Little bit.
pressing there.
Yep.
Yep. Give me a cough. Sore when you do that.
Mm-hmm.
Yep. Sore where my fingers are or further up?
Further up.
Right. Okay.
Yep, that's all.
That's where it's sore.
And there.
Sore up in there.
Not as much there.
No. And sore up in there. No. Okay. Now, can I get you to sit forward for me? You okay to sit forward? Is that sore when you sit forward like that?
No.
No? Good. Okay. Now looking at his back, because we're thinking about other abdominal organs, we're thinking about the kidneys, although they're actually retroperitoneal, but that's okay. So looking down his back, can't see any obvious scars or rashes or masses. I'm just going to feel down on the non-tender side. So I'm just going to feel down your back here. Sore when I poke in there.
No.
So I'm pushing quite firm over the renal angles to see if there's any tenderness with the heel of my hand. It's not sore when I do that. What about this side? Sore if
No.
I'm poking there?
No.
No. Not sore down there?
Nope.
Good. Okay. I'm just checking further laterally. Tender if I'm poking in there?
No.
Okay. The side here, that's okay?
Yep.
Yep. Okay. So when you palpate posteriorly, he's not tender in there. Okay. Final thing is to listen. Just going to have a listen to your chest. Is to listen to his lungs at the back, because occasionally abdominal pain can be referred from a lower lobe pneumonia. So a couple of big breaths in and out. So lifting over here quite laterally to the left lingular area, that's particularly known for giving referred pain, but it sounds quite normal. And a couple of big breaths on this side. Good, sounds fine. Okay, if you'd like to lie down again. Okay, so we've looked, we've palpated, we've auscultated. The final thing is percussion can be quite useful. So the final thing I'm going to do is tap on your tummy, okay? Tell me if it's sore, okay?
Mm-hmm.
So we can percuss in the right upper quadrant.
No.
Not sore. Hip goes duller there, that means the liver edge is there. We can tap or percuss in the left upper quadrant. Is that tender when I do that? A little bit. Okay. Just gonna,
No.
that's okay when I do that?
Yep.
Okay. Just going to try percussing over here. Bit sore when you do that. Okay. Right. And that's the end of the examination.